Oh my gosh, I am so sorry. I was on my way here today and I realized I was running out of gas. So I found a gas station, but as I was pulling in, I had to call my car insurance company and wait for them to give me an authorization to fill up at this gas station. They wanted to know why I wasn't going to my usual gas station. They even made me take a picture of my dashboard to prove my tank was on empty, as if I was going to lie about this. And then, even though I told them I was running late, they put me on hold for 20 minutes. Does this story sound ridiculous to you? Good, because it is. And yet, this is exactly how we handle healthcare. Somehow, we've just accepted the complex and maddening rules created by people who aren't in the exam room. Shouldn't patients and doctors be the ones deciding what's best? I've been a family physician here in Columbia for 15 years, and 6 years ago, I opened my own practice using a completely different model of care called direct primary care. You may be more familiar with the other, better-known option called insurance-based primary care. But how do you feel when you go to an insurance-based primary care office? See if this rings a bell. Your first 10 minutes are spent circling the hospital parking lot, trying to find a parking space. You hurry into the office and make it there just a few minutes late, which the office staff lets you know about. After signing in, you have a seat in the waiting room full of coughing strangers. Your first hour ends with you waiting. The second hour begins with getting called back by the nurse you've known for 5 years who still asks for your name and date of birth. After taking your vitals, you wait again. This time, 30 minutes spent remembering how many different doctors have left this practice that you've known in the past 5 years. 3? Maybe 4? The doctor hurries in and apologizes, and 7 minutes later, your visit is over, even though you realize you still have questions. You walk down the hall and find you're the third person in line to get your labs drawn, and now 2 hours after arriving, you're now leaving, feeling frustrated. So I'd like for you to imagine that you have diabetes and heart disease. You had a good job and had health insurance whenever you had your heart attack, but you've since lost that job and lost your insurance with it. You get a new job, but that job doesn't come with the offer of health insurance, and you're left with 2 options. 1, you can buy health insurance that you can't afford, or 2, hope your heart holds out and go without care. Now I'd like for you to imagine that you're in the hospital. You have health insurance, but on the day you're being let go, the doctor comes in and says, I need you to follow up with your primary care doctor within 3 days. But you don't have a primary care doctor. So from your hospital bed, you frantically call around, but the soonest appointment you can find is 3 months out. You call another office, and they say, we could get you in next week, but I'm sorry, we're not in network. And I'd like for you to imagine that you're 100 years old. Congratulations. Over time, your body has started to wear out. And now, the only way you're able to get to the doctor's office is by way of an ambulance, which you've done every 3 to 6 months, until you get a skin ulcer. Now you need to go every week, but the whole process is exhausting for both you and your caregivers, because just getting dressed at the age of 100 is a chore. We call this healthcare? It's true, isn't it? We talk about the bad experiences we have when we go out to dinner with friends. I did too, as the doctor. I was only 7 years into my career as a family physician, and I really wanted to help my patients. But the insurance, deductibles, premiums, copays, networks, reimbursements, billing codes, and charting rules were pushing me further and further away from my patients. I kept thinking to myself, there has to be a better way of doing this. And that's when I came across direct primary care. Direct primary care removes the red tape of healthcare, put in place by middlemen not in the exam room. How? Direct primary care offices don't take insurance. They don't take insurance. Now, I know what you're all thinking. Well, how much is that going to cost? On average, a $70 to $120 monthly subscription fee, similar to Hulu, gains you access at a direct primary care office. Why can direct primary care offices do this? Because primary care itself really isn't that expensive. Insurance companies just make it look that way. Remember my gas station example? You don't need car insurance to fill up your gas tank. You just fill it up and move on. Primary care can work the same way. Now, let's take a look at a typical office visit at a direct primary care office and compare it to that insurance-based example from earlier. First, you easily park, and when you walk into the waiting room, you don't even sit down because the doctor is actually waiting for you. You spend the next 45 minutes talking about diet, exercise, sleep, your home blood pressure readings, your medicines, and you slip in an update about your son's baseball team. The next 15 minutes are spent getting your labs drawn, and you find out your medicine can be refilled right there in the office. Therefore, it's been an hour and you've seen the doctor, gotten your labs drawn, you now have your medicine refills in your hand, and you have something that's rare in modern medicine. You feel cared for. Now, I would like to come back to our patients. We'll start with our patient with diabetes and heart disease. I have good news for you. Your current lack of health insurance doesn't matter. You can be seen at a direct primary care office. In fact, that set, affordable monthly fee allows you to better budget for your healthcare needs during times when money is tight, say when you're between jobs. You also find out that a cholesterol panel costs $2.50, and a 3-month supply of your medicine that can be dispensed right there in the office, $6. So you've now paid for your labs and your medicines for $8.50. And folks, we've just come across the biggest secret in healthcare. Paying cash for your medical expenses without using insurance lowers prices. So I'll come back to you, our patient who's in the hospital. Your next phone call just happens to be to a direct primary care office, and the doctor answers the phone. You find out you can be seen the very next day. And a few days after that, the doctor personally shoots you a text message, privacy protected, of course, to check on you. No extra charge. And let's come back to you, our 100-year-old patient. Your direct primary care doctor starts to come out to your house to see you. You tell the doctor this feels like a full circle moment to you, as you remember when the doctor used to come out to your house as a kid. And you wonder why that ever changed. Now, you may be wondering if these patient scenarios are realistic. Well, these aren't just stories. These are real patient stories. These are my real patient stories. Each of these patients knows that I'm sharing their story today. You know, there's something else that direct primary care offers. Meet Miss Betty. Miss Betty invited me to her 90th birthday party. It was the very first time in my career I had been invited to a family event. We had a nice time, and her son still marvels at the fact that his mom remembered me well beyond when she stopped remembering most other people. So, direct primary care is affordable, accessible, convenient, and personal. Now, I'm not anti-insurance. 80% of my patients still have insurance, and I think it has a rightful place in healthcare. But when more expensive care is needed, not filling up your gas tank, but a car accident. For other doctors out there, this is a rallying cry. Join the movement that's restoring trust in healthcare one patient visit at a time. For business owners who want to offer a health benefit for your employees, but you can't afford a full health insurance plan, direct primary care may be an option for you. And for all of you, you have a choice. You too can receive primary care that's affordable, accessible, convenient, and allows you to create a trusted connection with your doctor. This is direct primary care. Thank you.